So I asked on social media, what do you want to see on the channel? And if you ever get an idea into your head about something that you think would be beneficial to other people or to yourself, then please do leave us a comment and I'll try and get around to it at some stage. A big thing that a lot of people said was that they would like to basically have a video explaining, how about getting a diagnosis of Ehlers-Danlos Syndrome or Hypermobility Spectrum Disorder in Ireland, considering that it's very difficult to do and we don't have any consultants appointed by the HSE. Which you will probably know if you subscribe and if you follow us on social media, and if you've been to our website www.eds4ire.ie. So I suppose that's what I'm going to talk to you about today then. As I said, there's no consultant appointed by the HSE, and basically what that means when we say that is that while there are plenty of rheumatologists out there under the HSE, there isn't awareness of Ehlers-Danlos Syndrome or Hypermobility Spectrum Disorder. So a lot of rheumatologists just aren't trained to diagnose and to cope with EDS and HSD. And it's not uncommon for someone to be sent to a rheumatologist here in Ireland and for them not to have heard of EDS or HSD. And some have heard of the condition, but unfortunately don't really believe it exists. The ones that would have maybe a bit of interest just still aren't confident a lot of the time to diagnose it. And that really comes down to training. From what I've heard, and I'm not 100% sure if this is the case, but there's very little training of connective tissue disorders at all really when rheumatologists are going through the system. So that's unfortunately the case here in Ireland. But as always, if you ask anyone within the HSC, anyone high up, you will be told that all rheumatologists are trained to deal with EDS and HSD. And in fact, we don't need one particular consultant here in Ireland, which we all know, especially if you live here and have these conditions, is completely untrue. So then if you're, believe that you or your child has EDS or HSD, how do you go about getting a diagnosis here? Unfortunately, you probably will have to go private. Now, luckily, I suppose, if nothing else, we do have a couple of private consultants here in the country that will diagnose the condition. So it can be the case that you might have went to a rheumatologist and obtained a diagnosis publicly. And if so, I would actually like to hear from you, because I think it would be beneficial to do a list on the website for private and public consultants who will diagnose and deal with EDS and HSD. From my own experience from talking to people in the country, it seems very rare to get that diagnosis and to get a full diagnosis, not just mentioned vaguely, to get a full diagnosis or EDS and HSD from a public consultant. But if that's the case, please leave a comment below and let me know who you saw in the country, and make sure to say what hospital as well. And of course, what year, just in case they have since retired, unfortunately. So if you're going to go the private route, which you may find yourself doing if you've been in the system and through the process of waiting lists for years, which is the unfortunate case. I had seen countless different types of consultants and specialists throughout the years. None of them confident enough to diagnose. I'd also met with physiotherapists who were probably a lot better than any of the consultants I'd ever met. But again, they said, I don't feel confident in making that call, even though one physiotherapist said, I would actually bet money on you having EDS. So, she was so sure and so certain, but she just really couldn't make that call. So if you have been through the system for years, or if you've been through the system with your child for years, you may just be getting fed up and thinking, right, well, I'm just going to have to go private. So your options are as follows. Number one, Brian Mulcahy. Now, he is a rheumatologist in Cork, private, of course, as I just said. If you're in the EDS or HSD community and have been for some time, then you might know that name. Now, he is probably the closest we have in Ireland to any form of expert, but I don't believe from what I've heard that he would even call himself an expert. He has just worked with experts in the field, and more importantly, has a big interest in the condition. He knows a lot about it, so even just general conversation with him, you will learn a lot. Now, if you decide to go there, and I'll put all the links in the description of this video, because I think that will just be the handiest way around things. So you can look down in the description, you'll see all the links there that you'll possibly need. So if you decide to go to Brian Mulcahy, he is in Cork. I think he used to take self-referrals, but I don't think that's the case anymore. So if you contact his receptionist anyway, they'll let you know. So you'll probably have to get a referral from your GP, but that shouldn't really be an issue if you have a good GP. And if you have EDS or HSD, having a good GP is so beneficial. I would say that even above a consultant, because you even if we had consultants here, you would see your GP a lot more often. So hopefully your GP will be okay with doing that referral, because really it's nothing to them. And this is a referral that will go somewhere. It's not just, sometimes you get referrals to consultants and you get there after years of waiting and they're like, oh, sorry, you shouldn't have been sent here. But this isn't the case if you have hypermobility and you have pain. He really is one of the go-to people to go to. So assessment-wise, I can't remember the full time. I was there probably in for a couple of hours. I was actually diagnosed by Brian Mulcahy myself a few years ago, and I was in there probably at least a couple of hours. Now, he ran through everything, was very thorough, but obviously there's a price at that. I think it was about €350 at the time, so not cheap, especially if you have to travel to Cork and stay overnight and that kind of thing. But I learned a lot from him, I have to say, in those couple of hours, things that I didn't even know about myself. He's like, can you do this? And then I was like, why, is that not a normal thing that I should be able to do? Or, that the general population, can't do or don't have certain signs that people with EDS do. So from that, he was able to diagnose me, and it was brilliant. I mean, it was the first ever time that I just felt normal, that I just felt I belonged, and I just felt listened and validated. And luckily I'd never really had huge issues mental health wise around feeling like, I suppose having that feeling like, well, maybe this is all in my head, those kind of feelings. I never hugely suffered with that, luckily. But if you were one of those people, having someone really listen to you and understand and give you further information than you ever thought possible, that's getting that diagnosis and going through this process is well worth it. And unfortunately, it just comes with that tagline. So if you are a bit closer to Dublin, there's been recent talk of another consultant called Nicole Ambrose, and she's in the Blackrock Clinic in Dublin. And again, I will link that down in the description. Now, I haven't been to Dr. Ambrose myself, but I've heard great things from the community. She has, again, an interest in EDS and HSD, and she will go through the diagnostic criteria. And as far as I know, herself and Brian Mulcahy stick to the new criteria, so the 2017 criteria. But they also, I suppose, they're also open-minded as well to know, that not everything's so black and white. So that you will use the criteria, as far as I'm aware, and use all the new terminology. But they also have, I think, from what I've heard about Nicole Ambrose, they also both have just an understanding, I think, of EDS and HSD that doesn't come from just reading stuff about it. I suppose it comes from things that patients have, which is just lived experience, and I think they are maybe more aware of that than other private consultants might be in the country. So as I said, she's relatively new, but there's good feedback from her. And actually, if you've met with Dr. Nicole Ambrose, I'd love to hear from you in the comments section here as well, because I think that will benefit people that are watching this video in the future, that they can see your comments and your reviews underneath. And the same for Brian Mulcahy. If you've good and bad experiences with these consultants, put those comments down in the comment section. Price-wise, I think she's roughly the same as Brian Mulcahy, but if someone can correct me, please do. And it's great to have those two private consultants here in Ireland. Now, as I said, she's only relatively new, and Brian Mulcahy's been around for a few years, kind of doing what he's doing. But it's just not enough. I mean, we need what they have in the UK, like hypermobility units. We need a whole team. We need like public consultants, because a lot of the time, if you do get a diagnosis from a private consultant here in Ireland, so Brian Mulcahy or Nicole Ambrose or anyone else, and if you know of any more that you think are good, put them down in the comments section as well. But a lot of the time when you get that diagnosis from a private consultant, other public doctors don't always take it seriously. I think it's a combination of no awareness in EDS or HSD and thinking, well, if it was as common as you think it is common, or if it does exist, then there would be consultants for it. I think that's the logic. Because EDS is technically a rare condition, but it's also on the brink. So there's different types of EDS. There's 13 types. Vascular EDS is quite rare, hypermobility type not as rare, and that's very on the cusp of rare conditions. So I suppose from that point of view, other consultants and doctors look at it as not being a thing sometimes and not really existing, and they don't take the diagnosis then seriously. This is why we need public consultants appointed by the HSE who are fully qualified to deal with EDS, HSD and the comorbid conditions that come along with it, because we all know that it's not just bendy joints and dislocating, unfortunately. There's a lot of other issues going on that only trained consultants are aware of. So there are your two options really for Ireland. I'm talking and I'm making it sound a lot easier than it actually is. A lot of people can't afford that money, let alone the travel if you live on the other side of the country. And a lot of people have already spent 10 years on waiting lists, different various waiting lists, going through different systems. So, you usually get to that private consultant at the end of a horrible rocky road, and it's just not good enough, unfortunately. Now, your other option then for diagnosis of EDS or HSD is to travel to London to the Hypermobility Unit. Now, unfortunately, chances are, because it's a private clinic, that you're not going to qualify for any kind of treatment abroad scheme, or you're not going to get any help from the HSE because they see it as unnecessary. They see it that we can get diagnosis and treatment here, which we all know is not the case. So I've actually done both. I've had my diagnosis with Brian Mulcahy, and then I later went to the Hypermobility Unit. Now, I met with Dr. Alan Hakeem in the Hypermobility Unit, who at the moment, as I make this video, is about to take a year off to do some research and training, as far as I know, which all sounds brilliant, but it won't be taking on new patients. Now, I will also link the website then for the Hypermobility Unit, and you'll see all the various consultants on there, so, you can kind of pick and choose, apart from Alan Hakeem, who you could go and meet with. As far as I recall, unless this has changed, you can self-refer. So you look at the website there, it's all pretty easy to understand and to go through. The only huge difference, obviously, is price. So price-wise, going to London, I'm pretty sure it was actually the same as going to see Brian Mulcahy. So it was about 300, 350. Then you have to pay for flights, and you have to pay for accommodation. Had a slight malfunction there, video cut out, so this is kind of a second parter, sorry about that. As I was saying, if you are self-referring to London, it might be best to do that if you think you might have Chiari malformation. Again, I said already that I have another wee video kind of on the upright MRI and how to go about that, if you want to check that out. But basically, we don't have an upright MRI here in Ireland the same way that we don't have consultants. So if you need to use an upright MRI machine rather than a normal upright MRI because you feel like you might be having strange neurological symptoms that could relate to maybe cervical instability, some form of spinal instability anywhere in the spine really, or Chiari malformation or anything like that, things that you might be worried about, conditions that you've heard of, they don't always show up on the normal MRIs that we have here in Ireland. So really, I suppose if you're having, it depends on, I suppose, the severity of your issues, what you feel your issues are. But going to London can be very beneficial then if you already need to go, if you feel you might need an upright MRI. And a consultant then in the London Hypermobility Unit can talk you through whether or not they believe, from discussing your symptoms, if you do in fact need the upright MRI, which again, all gets very expensive. But it might be best for you to skip the private consultants we have here and then just go straight to London. Some patients decide to do that. Other patients like myself kind of went the route of I'll see a consultant here first and then the London ones. I suppose it was just less of a big leap. I think that's why I originally did it. I'd heard about Brian Mulcahy. I didn't really know a lot about London. So I thought, well, I'll go for the safer option and stay at home first and then maybe later do that if I need to. And I think, there's benefits of doing both. They're both expensive. They're both, relatively the same, obviously, but you have to pay for the flights and accommodation in London. But they're kind of the only two options that you're going to come across, unfortunately, unless you are a lucky one that, does go to the public route and gets relatively quick and easy diagnosis. But that's just not always the case. So I think, if I'm honest, the London Hypermobility Unit was simply amazing. Don't get me wrong, I'm nothing against Brian Mulcahy or any other consultants here, but in the Hypermobility Unit, I was able to discuss all the comorbid issues, and for the consultant there to go, that's very normal. I would suggest taking this medication or doing this kind of physio, or doing this, that, or the other. Before I'd even finish sentence, the consultant could tell me what comorbid condition that probably mostly, was that related to, or they could suggest, well, I think you need to see the physiotherapist here. And again, their physiotherapists are amazing. The expense builds up in ads if they want, if they do want you to go to see a physiotherapist, and if they do want you to get tests like an upright MRI. But it's just amazing. We really have nothing like that here. It's probably was one of the best experience of my life, particularly my chronic illness life, and it's not something that I would ever regret doing. It's just unfortunate that it's quite expensive, and that's why you'll probably see a lot of people in Ireland who have EDS and HSD have GoFundMe accounts, because it's not something that we want to do, but the expense can get ridiculous, and that's even before if you end up needing complicated surgery that some patients unfortunately need to go to Barcelona for. So I suppose that's really the pluses of the consultants here, and pluses for the hypermobility unit. Do I have a favourite? Do I have a preference, one or the other? I really think it's an individual choice. I think, however, London will always trump whatever we have here in Ireland. We have nothing like that here. It's a whole team, really. The consultant can go, I can make that appointment for you straight away. I know what physiotherapist you should see, or A, B, and C tests you should have run, and they can refer you on. They can do everything as one. They can put all the minor things and big things together and treat it as one whole condition, which really what EDS is. So I can see, why people though wouldn't want to take the leap as I didn't and go to London straight away. And it depends on severity as well. If you just feel that you need a little guidance and you want your diagnosis because you want that diagnosis on paper, trust me, I take that bloody thing everywhere with me, unfortunately, and all the printout from all my reports. It really is important to have the diagnosis. It even just having that diagnosis spreads awareness. So you're not going into other appointments, or you're not going into A&E if you have an unrelated issue, and you're not saying, well, I think I might have this condition. You can actually strongly say, I definitely have this condition, I have that diagnosis. So I think whatever route you go, diagnosis is very important for your mental well-being as well. So I think that's really everything. If I had to pick one, definitely London, but there's also pluses of going to the 2 private consultants here as well. And if you know of other private consultants here in Ireland who will diagnose EDS, and who you were confident enough in saying will go through the actual diagnostic criteria and not just diagnose on a whim, then please do put their details in the comment section, because I think that will be beneficial for everyone. And if you've been to any of the consultants I mentioned, feel free to put a review of them into the comment section as well. And I hope that has helped a bit. I will put all the links down in the description, as I've said.